The COVID-19 pandemic has affected us all. In this video, we take a look at the impact on the justice-involved population, highlight the importance of vaccinations, and examine the need for proactive measures to enhance health outcomes within correctional facilities.
It was right around the time that it first started. It was all over the news, and programs and visiting was getting shut down.
There was a remarkable lack of communications. The officers told us nothing. It was just a real stressful situation at the time.
Experienced a complete, total facility lockdown. We were told about it, not from any of the staff members, but we heard about it over the television news stations.
And we were seeing, cases start to break out. It was the cases in China starting to break out, and then cases just starting to break out in different areas in the world. And the first cases coming into the United States, which were really crazy, And it was a scenario where somebody in the pod would cough and everybody would be like, whoa, it was kind of like, people were joking about it at first. Then as it started getting more and more and more serious, everybody was kind of really starting to get freaked out. People were it got to the point where we were all just huddled around the TV, really looking for any kind of information we could have.
So a lot of patients come to me and they are worried about getting a vaccine. They're also worried about getting sick from a virus that they don't have any protection from. It shows that they care about their health and they want the best information possible.
I was diagnosed with COVID, so I was moved to a 23-1 lockdown, no contact.
We didn't have the opportunity to keep in contact with our family and friends. They locked us down and wouldn't let us wouldn't give us access to the telephones. That was a little bit traumatic.
So unfortunately, I think that what's happened with a lot of people who were incarcerated during COVID-19 is they carry with them a trauma of being in a situation where they couldn't protect themselves, and it broods the sense of distrust in them about receiving healthcare in prison facilities or receiving healthcare in the community. So when I see people who get out from prison or jail, I spend time really getting to know them as a person, getting to know what their values are, what their fears are, and building trust. So that we can start to change the narrative about what it looks like to get the health care that they hope to receive.
Staff wasn't really willing to give us information, and that affected my choice of getting the vaccination. I chose not to while I was incarcerated.
The military came in, the National Guard came in and started doing tests and COVID vaccines. Gave us the information and let us know what was going on.
I personally got vaccinated because I contracted COVID when I was in county jail, and it was a horrible experience. I didn't really want to go through that again, and after all the variants that were coming out, I thought it was probably the best choice to do that.
In my opinion, vaccination is a way that we can protect ourselves from something that the body has never seen before. So imagine you were playing for the Denver Broncos and you actually knew every single play the other team was going to run in that whole entire game. You'd like your odds of winning that, right? Things would look pretty good. That's essentially what a vaccine does for your body. It gives your body a sneak peek at what that virus looks like, so your body's immune system can make the proteins that help it fight off that infection. Of course, some people do get sick after they get the COVID-19 vaccine. They get COVID-19 a few months later or down the road. But the evidence is that getting a vaccination actually lowers your likelihood of getting really sick. So it means you're less likely to have to go to the hospital or less likely of unfortunately passing away from that infection. A lot of people are also under the impression that, hey, if I got the COVID-19 virus already, I'm all protected. I would love for that to be 100% true, because then this pandemic would be over much faster than it has been. But unfortunately, the virus itself does not prepare our immune system to fight off future infections as well as a vaccine does. A vaccine empowers your immune system much more to fight off the virus in the future down the road than getting sick with the virus actually does.
I got vaccinated because I believe in the science behind vaccines, and the science behind the vaccine is just to give your natural immunity more of a boost, to sort of be proactive in its ability to defend against what's coming.
So what a booster shot is an updated set of how the virus has changed over time. Our original vaccines prepared us to fight off infections from COVID-19 right after it came out. But since a few years ago, COVID-19 virus has gotten a little bit smarter and changed a little bit. And so what we have done in the medical community is design vaccines that are better able to fight off the current strain of virus that is spreading through the community. So if you want to be protected from COVID-19 that's going around right now, you need the updated booster vaccine.
Well, I'm just saying, get vaccinated, get your booster shots, and live your best life.